Now, it was created with the very best of intentions to help hospitals learn lessons when a baby or mother is harmed or dies. But our investigation has been hearing the maternity programme of the Healthcare Safety Investigation Branch, or HSIB, was riddled with flaws. One former senior staff member has told us about bullying within the organisation and failings which could have led to harm. Last night we heard from the mothers of Beatrice and Marnie, who were stillborn, and tonight other parents have come forward with their experience. And a warning, this report by our Health and Social Care editor, Victoria MacDonald, contains details and images you may find distressing from the very start.
Eventually they did an ultrasound scan and Beatrice's heart had stopped.
They did 2 checks and obviously confirmed that there was no heartbeat.
The amount of time that he hadn't had oxygen for was just so long that it caused such catastrophic brain damage.
Beatrice, Finn and Marnie, 3 babies born to different families in different parts of the country. Babies whose births went so wrong they were unable to survive. And babies whose deaths were investigated by this organisation.
Our aim is always the same, to conduct independent investigations that improve patient safety.
The Healthcare Safety Investigation Branch, specifically its HSIB maternity programme set up in 2018 to independently investigate harms and deaths of babies and mothers in hospitals across England. The aim to identify common themes and influence systemic change.
Channel 4 News has been investigating HSIB maternity after being contacted by families and by whistleblowers, those from within the organisation and those who have now left. They wanted to show us evidence of repeated warnings to their bosses that the programme was seriously flawed and could cause harms. At the same time, we've also seen freedom of information data, which shows that despite the millions of pounds spent, it seems to have had little impact.
This is how it works. If the families agree and it meets the HSIB criteria, a maternity investigator will interview the parents and the trust staff and look at medical notes. This is all then sent to a panel, usually made up of clinicians, and a report is written with safety recommendations. Finn was born in June 2021 but lived for just 1 week.
There wasn't the staff available on the day. So the birth centre should have been closed. Basically, they didn't follow the guidelines to monitor his heart rate properly.
You're going to be okay.
That's okay. Yeah, so it wasn't picked up that his heart had stopped. And so when he was born, it was a shock for them and for us. He needed to be resuscitated, but the amount of time that he hadn't had oxygen for was just so long that it caused such catastrophic brain damage. So yeah, we ended up having to turn his ventilator off a week later.
Ruth and Martin Kennedy readily agreed to an HSIB investigation.
They explained about the HSIB process, and they said, yeah, that if we wanted to sort of have this independent investigation, then we would be given the details and they would be in contact with us.
And what did you think at that point? You thought this would be a valuable exercise to go through?
Yeah, I think we just sort of wanted answers as to what
had happened and why it happened. We ended up going back on the first draft with over 80 points of where things weren't clear, they weren't in the right order, they had made mistakes, they'd left out key information, there was information that was included that wasn't in line with our set of events that we'd done our interview based on, and that the midwives' kind of side of things had been included.
So a report that should have taken 6 months took 15 months, and key learning opportunities were lost.
We were told from day one that they would do a full and thorough investigation, and in my opinion, they didn't.
But what has now become evident is the number of problems inside the organisation, highlighted in documents Channel 4 News has now seen. The Susan Newton whistleblowing investigation report, commissioned after a staff member made a complaint.
I've never seen so much evidence of systemic bullying over such a period of time in an organisation with so little being done to address it. I'm also concerned by the number of times discrimination against women is mentioned.
Another report by the King's Fund think tank to look at the culture and leadership at HSIB, including the maternity programme.
Bullying, sexism, racism and other forms of discrimination and unprofessional behaviours appear to be prevalent and tolerated. This goes right to the top of the organisation.
In their response, HSIB said,
"We have addressed any feedback received and made improvements to our maternity programme and how it functions. We've brought in a new leadership team and tackled issues around company culture to ensure all staff feel fully supported in the work they do. We are proud of what we've achieved in maternity care, in particular the thousands of parents who have been helped by receiving our reports."
Now, in an exclusive interview with Channel 4 News, one senior member of staff who left the organisation last week told us this.
The staff regularly referred to bullying within their programme and been feeling bullied and intimidated if they attempted to raise an issue.
Dr. Dawn Benson was a national investigator at HSIB when in 2020 she was asked to conduct a review of the quality and efficiency of the maternity programme. This is Dr. Benson and her colleagues' first report. This is the PowerPoint they were asked to change it to.
First of all, I was asked to dumb it down before it went to them. But I did look at it and thought, okay, so is there anything I can change in this to just land the messages in a kinder way? And then an action plan was created by the senior team from the maternity programme, but I'm afraid that I couldn't agree those actions because they didn't, in my view, they weren't able to make any adaptations or alterations. They weren't able to change anything because they were fairly meaningless and tokenistic.
Of concern, she said, the hierarchical structure within HSIB maternity, which has meant problems can't be escalated.
The staff reported that when they try to raise the alarm and alert senior people within the maternity programme that the investigations were not going down the route that they expected them to, or when they raised the alarm about other things that they were concerned about, some of those concerns were just normalised.
She also said that the use of clinical advisors for the maternity reports rather than safety experts meant wider problems within the trust or the health service were not picked up. Her review said,
"This often leads to reports which suggest responsibility for outcomes lie with the clinical practice of individuals and teams and fail to consider the systems of work which contribute to the outcome."
Dr. Benson was told to avoid the use of terms like fail.
You were asked to do a report that was then reduced to a PowerPoint presentation, and you don't believe anything happened?
I don't, but the senior management would say that they did create an action plan, and they tell us now that there is a work of to change the operation and to look at different ways of working, but that's years later, and I don't know how many people have been harmed, not just patients and babies, not just mothers and babies, but staff as well. And we wonder why there is a problem with the recruitment and retention into maternity services.
HSIB said,
"We are unable to comment on Dawn's allegation of changing the report, as this was a discussion with previous leadership who have since left the organisation."
But they also said Dr. Benson had taken over the training programme for maternity investigators, which they added provided the opportunity for safety science to become fully embedded.
There you go.
Did you have a nice sleep?
Martin and Ruth Kennedy are now the proud and loving parents to baby Remy.
Oh no, we've woken you up.
But their lives will always be overshadowed by the loss of Finn and of the answers they still haven't had.
Well, Victoria joins me now from our newsroom. Victoria, what do the failures and accusations you've been hearing tell us?
Well, as we've said repeatedly, I think, the HSIB maternity programme was set up for the very best reasons to prevent harms and deaths of newborn babies and mothers, and it is needed. Nobody I have spoken to thinks it is a bad or a wrong idea, not least because England has a poor record, particularly on stillbirth. Now, when we started looking into HSIB programme, it was because we had been contacted by Emily Barley. We heard from her last night, and she'd lost her daughter Beatrice. And she said her concern was that HSIB maternity had no teeth. They could make recommendations, but they couldn't enforce them. But then I began to be contacted by insiders, staff who were deeply unhappy with the way the programme had been set up and was running. In fact, I have never been contacted in my entire career by so many whistleblowers. They just kept coming, all deeply concerned. But I also have to say, none saying HSIB maternity should be got rid of, because it has the potential for so much good and it has amazing staff. But they were saying their concerns weren't being listened to. Now, HSIB is absolutely firm on this, that the issues that we've raised in our reports are historic, that there is new management and they have made improvements. They also say families are overwhelmingly positive about their investigations. Just one other thing, though. Legislation was passed so HSIB maternity could become a special health authority in the hope that it would have more teeth. But now it is going to be hosted by the Care Quality Commission, the CQC, and it's not absolutely clear what will happen next.
Victoria, thanks very much. And if you've been affected by any of the issues in Victoria's report, go to channel4.com/support, where you can find a range of places to seek help.